Hashtags for this session, if you're posting, SciRide23 and long COVID. And I want to extend a special welcome to our panelists in person and over Zoom, you'll see in a minute, who are generously taking their limited energy supply and spending it on us today. So with me here is Shamir Sweeney. She has been dealing with long COVID since 2020 and has become a fierce and passionate advocate for Black people with long COVID in urban communities. She has contributed to the long COVID survival guide and written for or been featured in a number of outlets, including the New York Times, the Washington Post, and NPR. Joining us over Zoom, unfortunately, she was too ill to come at last minute. Fiona Lowenstein is an award-winning journalist and producer with a background in advocacy-based journalism. They are the editor of the book, The Long COVID Survival Guide. They have produced materials to help journalists navigate long COVID, such as the long COVID source list. And Fiona sent us a great list of resources that I dropped in the Whova app for this session. They have also served as a long COVID expert for the CDC, the World Health Organization, and the Presidential COVID-19 Equity Task Force. And joining us also via Zoom, Julia Moore-Vogel is a leader of the long COVID wearables study at Scripps Research in La Jolla, California. And she is the director of the All of Us research program funded by the U.S. Department of Health Services. This is a program that's working to recruit and retain 350,000 research participants that represent the diversity of the United States population.
In my dark room, in my house, blind in one eye, as I wrote to my local politicians, as I wrote to doctors, I said, if this is happening to me, this is happening to other people. And so I wanted to, as a person who became a middle school teacher, but studied journalism for 2 years, I knew that this would be difficult to embark upon, but I also said to hell with that because I did not want to die from long COVID. I was literally in my room for 9 months dying, and I felt like somebody had to hear my experience and hear my story. And so it's an honor to be here, to be invited today, because women and girls that look like me don't oftentimes get this representation or don't get this opportunity. So for that, I say thank you, first of all. And of course, there's more to talk about, but I won't belabor because I know there are other people.
Thank you. I didn't realize you had a journalism background.
I do.
It's even more special to have you here. Okay, so apparently today's technical problem is with the projector, but Fiona, can you hear us?
Yes, I can.
Yay, we can see you.
Amazing.
Okay. Welcome, Fiona. Thank you so much for joining us. Can you give us sort of an introduction to your long COVID experience?
Yeah, so I got sick in March of 2020 in New York City. I believe that the day I got sick was March 13th, the day that a lot of things started to shut down in New York. So of course, at the time that I was infected, we really weren't being told to wear masks or anything about how COVID spread. I am a little bit unique in terms of that first wave long haul experience, in the sense that I was hospitalized. And I say that I was unique because a lot of people were not able to get the care that I got at that point in time, either because their symptoms were considered too mild to warrant medical attention. And I say not necessarily that their symptoms were mild, but that their symptoms were considered too mild, because we have to remember hospitals were incredibly overwhelmed and there were some very difficult choices being made about who to treat. But I also say that I'm a little bit unique in that sense because many people with long COVID did not necessarily have a severe experience in the acute phase, right? I had that severe shortness of breath, which was why I was able to be hospitalized and ultimately be tested. After I was discharged from the hospital, my symptoms remained, lingered, morphed. I started to develop new symptoms in the weeks and months after, and I began to connect with other people on the internet via social media, many of whom were younger, like myself. I was 26 at the time, who were also not getting better. Meanwhile, the mainstream media really wasn't even covering the COVID patient experience much, let alone what we would now call the long COVID patient experience. And so I was a freelance journalist at the time and had written a piece in the New York Times opinion section about my experience of being young and being hospitalized, and just kind of, how there might be more that we didn't really understand about this virus. And when I realized that I wasn't getting better, I wrote a follow-up piece about what we would now call long COVID, basically interviewing others that I was in touch with online about their experiences and linking to a very small, at the time, support group that we had created in an Instagram chat for people with COVID and COVID symptoms that were not resolving. That article is, I think, what brought a lot of us together in that first phase of the pandemic. We had over 2,000 people sign up to join that support group overnight after that article was published. And that support group eventually became the Body Politic COVID-19 support group, which developed into a long COVID advocacy organization and really a hub for a lot of other long COVID groups that developed from there. So my experience with long COVID, has continued in the years since. I think I'm lucky to have a relatively mild case, but I'm also very aware of the various privileges and aspects, of the ways that I live my life, working from home, not having, children or dependents to care for, that allow me to manage my illness in certain ways. And then, there are tough parts like today. I can't be there in person with you all because I got what probably would feel like a minor cold to a lot of other people, or might have felt that way to me before I got COVID, but has really knocked me down in the way that, most things do since getting COVID in 2020. So like Shamir said, there's much more to say, but that's kind of a brief overview. And I've been writing about long COVID and the COVID-19 patient experience pretty much ever since then.
Thank you. I'm so glad you're feeling well enough to join us virtually today. Yeah, and give us an introduction to some of the most recent science.
Hi, I'm Julia Moorvogel. Great to be here with you virtually, and especially with two panelists that I really respect, not only for the way that they share their own voices, but the way that they both magnify and lift up the voices of others. I also got COVID in 2020, later than the other two that are here. I got it in July. It was still a time when we were really, at least in my family, isolating as much as we could. And I believe I got it from the hallway of my apartment building. One of the times that I was taking my, at that time, 2-year-old outside to play, because the pediatrician told me I had to give her some fresh air, even though I was trying not to at the time because I was so nervous about getting it. So I've now had more than 3 years of long COVID. It has been the most difficult thing I've done in my life by far. And I'm a researcher by training, have done a lot of what I would consider difficult things previously, a long distance runner, et cetera. The biggest thing for me is just how absolutely relentless it is and how much you have to shrink your life to fit within it to try to not make things worse. I'm sure we'll talk more about the concept of post-exertional malaise, where, you do something that's too much and that makes your symptoms much, much worse. There's usually a delayed effect. For me, it's about 48 hours. And just being able to do little enough that it's not too much is my challenge all the time. Something as simple as, taking a shower with a shower chair and a handheld sprayer is usually too much for me. Whereas before I would go out and run 10 miles and think nothing of it. So especially as a lifelong overachiever, it's very hard to be shrinking my life that way. And it requires a lot of rest. So, what I used to think of as rest would be like laying around watching a movie or something. Now that is absolutely not restful. That actually would make my symptoms much worse. Laying in the dark in complete silence and trying not to even think. Like thinking counts as exertion now, which it never would have before. So I think that's an intro to my experience. I don't know if you want me to do some about the science now, or what you want to say next.
There for now. Thank you, Julia. I'm amazed that you're still doing the job that you're doing with all these challenges. It's very heroic.
Well, just like Fiona said, I have a lot of privileges that allow that, especially being able to work from home with my bed 3 feet away. Like if I need to take a break in the middle of the day, I have the sort of job where I can be like, okay, I'm canceling my meetings and laying down, and, being able to respond to my body in that way is really extremely helpful. And there are many, many jobs that I would not be able to do for sure.
Absolutely. Fiona, I want to go to you. You mentioned to me that you have a bit of a pet peeve about some of the things that have become almost cliched in the media, saying long COVID is mysterious and it lasts months or so. So what's problematic there?
So to address the second part of your question first, we often see media headlines and quotes from articles that long COVID can last months. All three of us have been sick with this disease for over 3 years. Yes, long COVID can last months. It can also last for years. There are also related post-infectious illnesses that we know people have lived with for decades, right? SARS, the first SARS outbreak, led to long SARS in a number of people who are still living with that disease. So this sort of misinformation has a number of outcomes. I think, first of all, it can give people false hope. It can minimize the disease. And I'll say that I actually spoke at a conference, a pharmacology conference in the spring, where somebody told me that they were aware of a clinical trial that had not moved forward because the researchers did not believe that people with long COVID would still exist in 7 to 10 years when the trial had been completed. And they said that they felt like, media headlines that were referring to long COVID only lasting for months might have something to do with that. So it's really important that we understand kind of the spectrum of severity here, and the fact that many people with long COVID, even if they've experienced some level of improvement, which some people do, are still sick, years down the line. In terms of referring to long COVID as mysterious, I understand that long COVID seems new to a lot of us. It certainly seemed new to me, right? I didn't know necessarily when I got sick that you could get a virus and never recover. But people with long COVID are certainly not the first people to become temporarily or permanently disabled by a viral infection. People with myalgic encephalomyelitis, sometimes called chronic fatigue syndrome, often abbreviated as ME/CFS, have been living with a similar disease, again, for decades. That disease is well documented. And we actually do know quite a bit about long COVID, despite the fact that COVID itself is a relatively new disease. The term mysterious can also sometimes kind of play into this idea that there's no hope or no possibility for finding answers about what's going on here. And I think it also often kind of plays into this idea that patients and people with long COVID kind of have perhaps some sort of psychosomatic issue going on, that it's just mysterious, that we're hysterical. These are terms that have a little bit of a loaded history because of the ways that they've been applied in the past to people with related illnesses such as ME/CFS. But I'm sure Julia could also tell us a bit more about why exactly long COVID is not entirely mysterious and how much we really do know about the disease right now.
You took the words out of my mouth. Julia, I'd love to hear a little more about, what do we know about who has long COVID, how many people, and what might be happening in the body to cause this?
Sure. I think one of the things that is surprising to a lot of people is just how common long COVID is. We estimate that over 65 million folks worldwide have it. About 15% of adults in the US have ever had long COVID, and 6% currently have long COVID, and that's according to CDC data. At least 4 million people are out of work as a result of long COVID just in the US, and we think that's probably an undercount because it's older data. And some studies show that the quality of life of folks with long COVID is worse than many other conditions that we do consider as a society debilitating and serious, like advanced cancer, for example. Given that infections have taken place worldwide, we can expect that there's long COVID worldwide, although documentation varies depending on how much each government or each society has decided to document the cases. So as Fiona said, or alluded to at least, there's a ton of literature actually at this point, 3 years into the pandemic, characterizing long COVID from a patient experience perspective and a real biological, cellular level perspective. There are a lot of fascinating things about it. One of them is that over 200 symptoms can be present in any number of combinations. So this can make the disease really difficult to characterize. One person's experience can be completely different than someone else's, but they all have the common cause of having this initial infection that led to this disease. There's a wide variety of severities. Fiona's mentioned maybe they're on the more mild end of the spectrum. Others are completely debilitated, have to lay in a dark room all of the time, the experience that Shamir was referring to. Some people's disease really changes over time and they get better, some get worse over time. So there's a huge variety in the presentation. And I think that makes it really difficult for both the physician community to learn about and diagnose, but also for people on their own to recognize it in themselves, especially in the early days when there wasn't a lot of testing. And now when folks are sort of not thinking about COVID anymore, thinking it's not out there anymore and not testing, you might not even recognize you have an initial infection, let alone then connect your later symptoms. Another problem with that piece is the public health communication part that, you know, there's this message out there that, okay, the pandemic's over, don't worry about it anymore. And there was never, in my view, an adequate communication of the risk of long COVID to the general public. And so that also makes it hard for folks to recognize that it's occurring in themselves. But anyway, back to the biological piece of it, there are a lot of different theories about what is causing the disease. And, you know, we expect it to be a combination of different things. One of them is microclots in people's blood, which have been demonstrated in many different samples of blood from folks with long COVID. So the idea is that could lead to poor oxygenation, as well as things like pulmonary embolisms and strokes that we see at a higher risk in folks with long COVID. Another interesting one is the different ways that the immune system can be dysregulated, which there was just a really interesting paper that just came out in Nature from Akiko Iwasaki's group and many collaborators that demonstrated a lot of different assays about immune dysregulation. And from my perspective as a patient, one of the most important pieces of that paper was that there was 94% agreement between what the biological assays said about people having long COVID and the patient reported outcomes about whether folks had long COVID. So, you know, Fiona mentioned how there's a lot of dismissal going on in a lot of different places in the medical community saying, you know, pushing people aside in terms of their outcomes. And there's a lot of concern that, oh, we don't have a biomarker, so we can't really do clinical trials. Well, actually, the patient report is just as good as the biomarkers, you know, the best biomarkers that we have right now. And so there is enough to do for the trial, enough evidence to do the trials now. Because those trials haven't been done, there are currently no FDA-approved treatments for long COVID. There's some symptom management work that folks can do that can give folks some relief, but we really need more recognition of the problem and more funding to be able to do the trials. I'll stop there before I advocate too much more about the trials, because that's the thing that I think we need the most. But any other questions about the biology at this point?
No, we'll get back to the trials and the funding issue in a bit, but I want to move to Shamir. We know that women and people of color can have a tough time getting taken seriously at the doctor's office, especially when they have a quote unquote mysterious ailment. So can you talk about, you know, how that's factored into the experience of you and people like you?
Sure, absolutely. But I want to first say, in addition to, I think you asked Fiona about the frustrations with the media. So I do have frustrations with the media. And the first thing is that we have a default setting of whiteness. And so what happened was in COVID, although we know that, and it's been well documented, that BIPOC communities, especially Black women and Latino women, are often misdiagnosed, often forgotten and dismissed for cancer, endometriosis, diabetes, and so on and so forth. We knew that. But when COVID came up, we still deferred to whiteness. And it wasn't until 3 and 4 months after COVID became real to all of us that I saw my first story about a Black woman in Charlotte, North Carolina that had COVID and exhibits some long COVID symptoms. And that's a shame. That's the frustration with the media. And that is also why it took 2 years after COVID in 2020. I'm a new waiver as well, like Julia and Fiona. That's why it took, after I was asking political leaders, I was asking people on Twitter, I was asking Social Security Administration, I was asking everybody, where is the data for BIPOC communities who have long COVID? We were doing all these surveys, we were tracking all this data, but the issue is there was no challenging of the fact that there were 34% of Black and Latino people who had long COVID, and we just found that out in October of 2022. And so when we talk about doing research studies, we're not thinking about the fact that 34% of anything may not catch a lot of people's attention, but it should catch our attention. And so it's frustrating to ask for numbers and not see them. And it's also frustrating to pretend like something does not exist when it obviously does. And so, but it's so funny because my experience was nothing less than just that default setting and also that type of treatment. In the course of And I was just reading over my medical notes because I'm doing a conference for Black women, a virtual event, next Sunday. Because I got tired of being asked to speak to the media. I wanted to do something for my community that wasn't something that I charged for. I'm not doing consulting and things like that. So I said to myself, I want to help other Black women and families, because as we know, women are storytellers. Women carry a lot of information, right, back to their families and their friends, especially in my community. And so I wanted to be able to offer those women solutions, or at least assistance, to be able to do what seems impossible, in part because we're people of color and there's a lack of accessibility. So I, from the very beginning, as I was looking at my medical notes, because I want to explain how more Black women can get medical diagnosis and get Social Security benefits and other benefits that they need in order to provide for their families, because statistically we know that Black women are usually, the heads of household, and they, they're educated and they make a lot of income. That's just what we statistically know. But we pretended that we didn't know that people of color had long COVID. But I was called when I was asking why were these tests being done to me in the hospital, sitting in the hospital with these wires coming from out of my head. I was told to sit back and relax and that I was tripping. That's what I'm saying. That's not what the doctor said, but he basically told me I was tripping. And then I went into my medical notes and found out that he thought that just because I was simply asking him, what does he think is happening to me and why is it happening? He said I needed a psychiatric evaluation. That meant he thought I was crazy. And so in the media, we have to start challenging demographic information that is pertinent to research and data that'll help everybody, not just a few somebodies. Even now, I moved to Poughkeepsie in June of this year. I got married and I moved to Poughkeepsie. And my biggest fear, even now still, is running across a doctor who will dismiss me and not take my story seriously. It actually almost happened when I went to like a patient first or something in my town, right? And I'm like, hey, what's up with me? Because I had this weird thing happening. I don't know whether COVID tests were negative, which y'all know how that go. And, the doctor, the provider, she was like, oh, I think you're fine, go home. So I went home, you know why? Because I get exhausted with, and we know this, right? Fiona and Julia, we know we get exhausted with trying to prove what Julia said is data that we know for the past 3 years. I went home with my husband and I was just like, man, she didn't help me. Then I said, you know what? I know better than this. I went back to the urgent care spot and got a different diagnosis, right? Because it's become imperative to me to tell my story, but not just to tell my story, because I don't want to hear my story anymore as much. It's imperative to me to empower other women of color to be able to tell their stories and get the resources they need.
Thank you for being so candid. That's very powerful. So let's get back to the funding and research issue. In late 2020, Congress sent the NIH $1.15 billion for the Recover Initiative for long COVID impacts. And as Julia just said, there are no treatments out there. Julia, do you want to start first with what happened there?
What happened, Julia?
Sure. Yeah, I think there are multiple different ways to approach long COVID research. And as a patient, my urgency is I want to feel better as soon as I possibly can. And I think that the focus that Recover took was more of a long game of, let's try to characterize the disease deeply. Let's, have results that pay off in a longer time frame. Whereas what I would have done was just, prioritize some clinical trials based on what we knew at the time a little bit faster. So Recover is starting some clinical trials now, and I think there's broad agreement within the NIH and outside that the trials that they are funded to do in Recover is not going to be sufficient for what we need for long COVID in general. That shouldn't really be a surprise given that there are, billions spent on clinical trials for all sorts of disease for many, many years. And this one is impacting so many people, and we just don't have good treatments. We're not starting from anywhere. It's not like we have chemotherapy and we're trying to move to personalized medicine. It's like we're starting from zero. So of course, there's going to be more that needs to be done. And I think there's a lot of foundational research that will come out of Recover. And in the meantime, there's still more that we need to do to be able to get patients relief sooner. Fiona, I think you had some good thoughts on this too. I don't know if you want to speak up too.
Yeah, I was going to say, Fiona, do you want to weigh in here?
Yeah, so another big issue that, and I know Shamir has been involved as an advocate at points with this as well, so I'm sure she has thoughts too, but another big issue that we've heard from patient advocates about is that there has not been enough engagement with researchers and experts on related conditions and diseases such as ME/CFS, dysautonomia, mast cell activation syndrome. Those are some of the most common diagnoses that people with long COVID who are actually able to seek and access comprehensive care get, right? And those diseases are not brand new. So we should be consulting with the researchers who have been studying those diseases for decades. So that's been something that a lot of people with long COVID have been concerned about, who have been involved in this. They feel like there's sort of been a reinventing the wheel. There have been ongoing debates about controversial treatments that have already kind of been debated for these other diseases. But once again, there's, debates happening, and debate is not necessarily wrong or bad, but debate without information and debate without, including the sorts of people who can kind of provide that historical context on here's what's happened in the past can be a problem. There's also been a lack of, I think, adequate engagement of patient experts. And so the patient-led research collaborative had a letter, has written a couple of open letters to the NIH about how to adequately engage patients to make sure that, for example, when clinical trials are set up, they're not set up in such a way that they're inaccessible to the very people who are supposed to be participating in them, or that they're actually draining the energy of those people before they can even get to the trial to participate in it. So that's something as well. And then there's also been this issue this summer where I think the NIH lost quite a bit of trust with the patient advocacy community because there were a couple of tweets that an NIH committee put online sort of saying, if you have long COVID, you should seek treatment. And, there were comments on that tweet saying, what treatment are you referring to? Like, we don't have any. And 35 of those tweets were hidden by the NIH account. And that kind of created, an obvious issue where patient advocates felt that they were being silenced. The NIH had to say, okay, I think we acted a bit inappropriately in, hiding or deleting those tweets. But there's really been a huge rupture of trust between the agency and the people that they're supposed to be serving at this point, I would say.
And I'll quickly add to that, Amber, in addition to what Fiona says, I'm actually, and I have been working with patient-led research collaborative for the past year and a half or so, and I actually met a lot of the women who are brilliantly running the collaborative from Body Politic initially. And I am actually a part of I don't know what to call it, but a part of just a research collaborative inside of PLRC, where what we talk about and what we discuss, all we discuss is trying to find connection and treatment between long COVID and ME/CFS. Now, I just saw last Wednesday a chart that of probably about 75 medications that could possibly be used, right, as treatment options for doctors to do their thing with long COVID patients. Yet that's not something that we talk about all the time. So it's very interesting to note that there are things that can be done. There are treatments, there are chemical treatments, there are other types of treatments that have been brought to the forefront with these researchers and scientists at, Mass General in Massachusetts, but we don't know about them. And as Fiona mentioned, there is a huge distrust, especially with the people of color, with the NIH, because even just in discussing language and how to communicate, how to gain engagement with patients, Indigenous patients, Latino patients, Black patients, Asian, BIPOC patients, there seemed to be a disagreement about how to approach that. That's something simple to engage in a visual, clear, I'm with you, I stand with you way. And we saw a lot of that being dismantled in just these silly conversations. And so I would be the first to tell you that I did drop out of Recover because I did not feel like I was going to make as strong of an impact in the research. And I did not see as progressive research as I do in this research collaborative that I'm in now. So the data is out there. Medication and treatment is out there. We're just not talking about it, and we are not focusing on it for some reason.
Thank you. So all three of you are bringing so much energy to this panel, but I know people with long COVID need some special consideration as sources. Let's start with Fiona. Talk about where can we find you, first of all, and what should we know about interviewing people with long COVID for stories?
Yeah, so I think support groups are certainly one way to find sources with long COVID, but it's always important to understand kind of the ground rules of any support group that you're engaging with. Some support groups are public and journalists are welcome to, join the support group. But a lot of support groups are private and you need to kind of contact the person who runs that support group with immediate inquiry and be clear about what you're looking for. Social media can also be a good way to find people with long COVID, the hashtag long COVID. A lot of people are following that. So that can be helpful as well. And then the long COVID source list also can be a good option as well. I would say that in terms of tips for journalists, I always recommend being open to a variety of formats for interviews. For some of us, a Zoom interview is possible, or it might be possible on a given day. Other people might prefer to talk on the phone or talk on Zoom with the camera off. In other cases, it might be easier for someone to write out an answer, right, via email or via text. I found that exchanging audio messages via WhatsApp or text can be a great way to give someone the ability to give you kind of those verbal answers, but over a longer period of time, like a series of days. And in general, it's always important to build in extra time for sources with long COVID because it's an energy limiting disease. You never know when someone's going to be experiencing a symptom flare or a crash. And so if you're on a tight deadline and you're kind of waiting for someone to get back to you very quickly, you don't want to be in that situation where you're having to pressure a chronically ill source, to kind of overexert themselves. I would also say in terms of fact checking, it's very important to be clear and explain why you're asking certain questions. So for example, if you're asking a source, did you ever test positive for COVID when you had that initial infection? You're going to want to be clear on whether or not that is something that you're going to include in your story and whether or not you're using that piece of information to invalidate their long COVID diagnosis in any way. Because at this point in time, we know that there are a lot of people with long COVID who didn't get access to testing when they first got COVID. That's still the case, right? A lot of people get COVID, maybe it manifests as a mild cold, they don't get tested, they go on to develop long COVID and they end up with a clinical diagnosis of long COVID. But a lot of us are a little bit traumatized from an earlier point in the pandemic, and this still goes on today, where people, doctors or family and friends will kind of say, well, if you didn't get that COVID test, you don't have long COVID. So just contextualizing, fact-checking questions. And I think, a lot of folks who have I know there was a seminar earlier today on trauma-informed reporting. So I think a lot of those tips are helpful here as well. Another note on fact-checking, just be mindful if the fact-check is taking place significantly after the interview, because a lot of us have some level of memory issues or cognitive dysfunction. It can be very hard to remember what you said in an interview 2 weeks ago, let alone 4 months ago. So it's important to kind of keep that in mind when fact checking as well. And then the last thing I'll say is I would really recommend understanding the difference between professional long COVID advocates, right? People who have been in this space, engaging with agencies, engaging with government officials, and long haulers who are not professional advocates. Both serve important purposes in news stories, but using a professional advocate to illustrate a story about the average long COVID experience isn't particularly accurate or helpful for a variety of reasons, right? A professional advocate is likely going to be better at navigating those systems and maybe more experienced at it than somebody who doesn't have that professional expertise. A professional advocate also has a lot of other things that they can share with you outside of just their lived experience of living with long COVID, right? Someone who's living with long COVID and doesn't have that professional expertise may be better able to illustrate some of the realities of living with long COVID on a day-to-day basis when you don't have access to, researchers at Mount Sinai who are publishing papers on a regular basis, et cetera. In general, just be open to people's accommodation requests, even if they might seem unusual to you, and understand that lived experience is very valid expertise, and that the first people to really talk about, research, and write about long COVID were all people living with that disease. So those are the experts often to go to first, and they shouldn't just be included as kind of colorful human interest piece at the end of a story that mostly quotes researchers.
So guys, this will be the last sum up question for me, and I invite you to start thinking about your own questions and come up to the mic. I'd just like to ask each of you what stories need to be told about long COVID that aren't being told or aren't getting the attention that they deserve. And let's go to Julia next.
Sure. My point about the need for trials is definitely one of them. The other that I haven't talked about as much is how, for the general person that doesn't already have long COVID, one, that it is a reason that they should consider still taking precautions because COVID is out there and you could get long COVID after your second, third, fourth infection, even if you got out of the first several fine. So it is an ongoing risk, even if you haven't caught it yet. And then part two is if you have a loved one with long COVID, what you can do to support them and educating yourself so that you're not putting the burden on them to educate you about what they're going through and what they need, but for you to be able to think about the small things that you can do to help. One of the things that has made the biggest difference for me is the loved ones in my life that are sticking around, which there are many that have not, but the ones that really can be there for you, whether it's emotionally or helping physically around the house, can make a world of difference in someone's experience.
Jameer?
Absolutely. I read an article recently from Deadline. I'm following the SAG-AFTRA and the WGA strike. And I read something recently on Deadline from Jessica Lange, who said that Hollywood is no longer creative. And so it made me think about how we're telling this story. And so I'm especially glad to be here with people who understand the science of writing about science. And so it made me think about the fact that as I was getting ready today about the ology of what story you choose to tell, the biology, the ecology, but most importantly, I think we need to tell more BIPOC stories about the pathology of the people that you're interviewing and the people's experiences, because they're not monolithic, right? It's just not telling a story about a sick person. I'd like to see stories about, people who protest. My new thought as I create, the Black long COVID experience is how do people protest from their beds to get the things that they need? What about, as Julia mentioned, the other people in their ecosystem that you miss and who are dealing with this? Like nobody's ever interviewed my husband and asked him what is it like to have a wife who spends probably maybe sometimes between 10 to 20 hours in bed every day. The pathology of people of color and people in general, but notably people of color, about what it feels like to be here now, to be this sick now. That's what we need to talk about. And the challenging of why, long COVID bills have died before, 2 long COVID bills, right? The Long COVID Care Act and another one that I know, Ayanna Presley, who I was working with at one time, they both died before they even got a chance to just even be like really talked about in the Senate and Congress. And so there's a pathology of the patient that I think that we miss. I also think that we miss in our media coverage the creativity of the patient. If you can't go to the patient, a lot of times now, a lot of us are still so scared to have journalists and photojournalists in our homes, then, why not ask them to tell their story and some videos that you can chop up? We've really got it. Why not have talk to their children or talk to their mothers, or just really get a 360 view if you can. And I know it's difficult for you all. So you all, hats off to you all, because for the last 3 years, you have done an incredibly difficult job telling these kinds of stories from every avenue. But it still is your responsibility, just like it's mine and Fiona's and Julia's responsibility, to get to the pathology of the thing. and to tell really human stories and not just tell about a sick person, but really get to the meat and the potatoes of who that person is as much as you can. Because that's going to get the attention of people who, as you all know, media is such a weird space right now. Y'all know that, right? Y'all know that media is in a precarious space. So it's up to us to tell creative narrations of stories that will challenge governmental systems and healthcare systems in a way that just writing about it or tweeting about it won't do.
I would read those stories. Fiona, do you have anything you want to add here?
Yeah, a couple things. We need more stories that actually look at long COVID prognoses many years down the line and interrogate this question of recovery from long COVID. I think there's a lot of stories of long COVID recovery that are not quite that simple, my own included, right? Where we see kind of relapses or, long-term issues emerging down the road. How many people have actually recovered from long COVID? Is there a way to track that? What does it look like? How can we follow up on those people down the line? We also need to be looking at long COVID as a labor story. There have been a fair amount of business-focused publications that have looked at this in terms of the labor shortage, right? We are not going to have enough laborers. That's kind of the story. And that is an important story. It's also a little bit of a dehumanizing headline. I'm interested in more stories that look at the intersection between long COVID and ongoing labor movements and strikes, right? How does the existence of long COVID, for example, the disproportionate impact of long COVID on healthcare workers play into some of the labor issues that we're seeing with nurses striking right now, with healthcare workers striking right now? That's a really interesting story that I haven't seen written. And then I just want to reiterate what Julia said, that long COVID and COVID mitigation go hand in hand. We are still missing the mark on this repeatedly. It's a public health communication issue. For example, CDC changes in masking requirements in healthcare settings. How is that going to impact new cases of long COVID? How is that impacting healthcare workers living with long COVID? That's a story I haven't seen either. And the last thing I'll say is more stories on long COVID need to understand the spectrum of severity and the fact that there are many people walking around saying, well, I've had chronic migraines every day since I had COVID a year ago, but I don't have long COVID, right? There are a lot of people with symptoms that could be categorized as long COVID who don't understand that they have long COVID. There's an interview with Dr. Petrino, who was part of the Nature paper that Julia referenced, in which he describes a solid portion of their control group actually not being able to be part of the control group because when they interviewed these people, they mentioned symptoms that qualified as long COVID. So what is going on with all these people who perhaps have long COVID, but don't realize they do? What went wrong with the public health messaging there? What do people on the street think long COVID actually is? And what is long COVID if we understand it in this broader spectrum of severity? So those are some suggestions I'd put out there, in addition to just the fact that long COVID can impact every aspect of your life, from work to relationships to housing, et cetera. And we really do need more stories, as Shamir said, on people from marginalized communities. I think we have had a lot of stories on white upper middle class people, on their individual experiences, and I'll count myself in this, these kind of, for lack of a better word, vanity stories about people like myself of how long COVID changed my life. I don't think we need a ton more stories like that right now. I think we need more stories digging into how this is impacting the lives of people who don't have regular access to healthcare, people who are undocumented, people who are working jobs that don't have paid time off, and people who don't have the social safety nets and are being forced to push through, repeatedly be exposed, repeatedly be infected, and are likely to be further disabled as a result of those factors.
I also want to add that I think that we also need to be talking about the sociology of long COVID. We've done a fair job of discussing that, but sociology, of course, as you know, is the study of what happens socially to you when you encompass long COVID. And so for me, I've always felt like it was my responsibility to tell the story of what specifically happened to me from a financial standpoint, from a psychological standpoint, a mental standpoint, and from being a disabled woman standpoint. And I think that thinking about the sociology of what we're talking about is something that is very crucial to the kinds of stories that we tell. As I mentioned before, we haven't invited other people that are surrounded by long COVID patients into the fray. We haven't challenged enough our governmental agencies who you know, for the average person out there who has a decent job, a decent pay, middle class, and they're doing okay, they oftentimes look at people who are collecting a Social Security check or a disability carrier check as just looking for a handout. They don't know that over 680,000 people now, right, as of October or early January, are still waiting, are signing up for long COVID, who are signing up for disability based upon long COVID symptoms. And so we need to challenge those systems, because if we had a government shutdown, right? They say that only 7,000 Social Security agents, workers or employees would have been in their offices or doing the work. But if you get a paper Social Security check, you would have been waiting and waiting and waiting, because guess what? The United States Postal Service is an independent government agency. So we don't think about the difficulty that people are having. And we're not talking enough about the labor shortages as a result of long COVID. We're in election season, so we're playing that game. But the truth is, we've lost, I was reading this morning, something around 20-something million, possibly workers full-time because of long COVID. And we keep reading this book. You ever read a book on your Kindle, or I love paper books still, and keep reading the same page over and over again? Your brain after a while gets jumbled and you start thinking like, what in the hell am I keep reading the same page, right? And because we have all this information after 3 years, it's like we're reading the same page. It's time to turn the page and tell real stories about treatment, research, and the humanistic side of this thing, because it's going to continue to destroy our economy, people's mental health, and their ability to cope. Climate change with mental health, that's a grand intersectionality with a person who has long COVID. How does the climate affect your mood? How does this affect this? And we're just not talking about it, and we have to.
There were some good quotes in there. Guys, I invite you to come up and ask your own questions.
Sure.
Hey y'all, so hi, I'm Kenya. I'm a public health reporter at the Associated Press. I just started, that's why you haven't seen my byline yet, but it's soon come. But I just came first. The first thing I want to say is, when we're talking about sources of color, I just came from an organization called Capital B, right? It's about Black folks. And what I will say is, like, one thing I learned, even though I'm a Black woman myself, one thing I learned is when you're trying to like do the sourcing for people of color and those who are marginalized, you gotta like really think about the time it's gonna take. And I just wanted to talk to y'all about that really quickly, because it's gonna take time, because you're talking about people who, one, have this really ingrained distrust in the media, for one thing. Like, when I told my family I was becoming a journalist, they were like, oh, so you becoming them folks, like as in the ops, you know what I'm saying? So there's that. But then also people who like don't necessarily have the same access to the press that wealthier people have. So therefore it's gonna take a lot more digging than it is for some people who are able to be more visible, right? So there's that. The thing that I wanted to ask you all about is so when I'm thinking of long COVID, right? A lot of times what I've been wondering about is people who are people of color who do front-facing work, like essential work, like working in grocery stores, working at the airport and things like that. I feel like I haven't seen a lot of stories of those folks, right? A lot of times when I see long COVID survivors, it's folks who are able to work from home, but I really want to get that perspective, and I wonder what kinds of stories you would like to see from those folks, and yeah, it sounds like that's part of the labor story that Fiona is talking about, that you're talking about. But yeah, I'm just curious about what you all think of that part.
I'll speak first. I think going back to, I spoke for the NIMH. It was a conference on mental health. It's under the NIH, and I talked about myself and the ecology of what happened when I lost my job as a teacher they fired me in 2022. They finally sent me a letter saying, we no longer need your services, blah, blah, blah. And that was just making, as in my immediate family, I was I went to college, made, more money than my mom, blah, blah, blah. But my mom is an essential worker, but I was just thinking about, okay, so that was $60,000. I intended, as I always say, to help my mom out of her retirement, to help this person and do this, because I'm a woman that doesn't have children, so I can, kind of do. And I said, it's no stories about the ecology of what happens when an essential worker of color can't work.
Mm-hmm.
And as you know, our women are carrying a lot of the burden. So if I get long COVID and my mother was a unit clerk at a hospital, right? If I lose that $40,000 salary and I go home to kids, I go home to this rising living costs, what the hell happens?
Right.
And we don't talk about, that's what I'm talking about, the pathology of what happens, the study of what this looks like for people with the lowest access. We talk about it, but we don't touch it. And it needs to be touched. So I thought about this as today, and I wrote in my phone, I said, we are responsible to tell those stories. And I think another thing I'll say is Fiona took a huge risk by inviting me into this space, and I'll always be grateful to her for inviting me into spaces to talk about my experiences. And I think one of the major problems is we are now becoming so afraid to take risks to pull people in to tell their story. And I think that's a part of the problem, is that we have to reach out and we have to be willing to truly follow those people and tell those stories. Because if we don't, then what? We'll be talking about the middle class person and up.
Mm-hmm.
And we'll be talking about celebrities that had to quit because they had long COVID. And we won't talk about the grocery store worker or the high school janitor. And those people need to be covered because some of those people are responsible for everybody in their household.
Mm-hmm.
And that's just what I think.
Thank you.
You guys want to weigh in, Fiona?
I just wanted to recommend 2 potential organizations that might be interesting to connect with. There's a third one too that I'm looking up on my phone now to see if I can, so three possible ones for you. The first one is Long COVID Justice, which is based in New York City. I believe they actually have a grocery store clerk involved with them who is dealing with long COVID, who might be interested in talking on the record. But I think they would have thoughts on this and thoughts on how to engage. They do a little bit more local work. Marked by COVID is another organization that I think could be helpful for sourcing. It's another organization run by a person of color. It's focused on it started as a COVID grief group for people whose loved ones had died from COVID, but many of those people are also living with long COVID because they were infected at the same time that their loved ones were. I'll say this is another story that hasn't really been told and I think is quite interesting and worth telling. They also have a lot of local chapters and I think have more of that kind of on the ground reach. And there's a third one, which I believe is based in Canada, but I could be wrong, called Birch, Black, Indigenous, Racialized COVID Health.
It is in Canada.
Mm-hmm. They're on Instagram. They may be worth connecting with as well. And I think in general, healthcare workers and educators are some folks who it's been easier to get in touch with. And we've seen some articles, like there was an article in Ed Week, and there was a good article in the British Medical Journal focusing on healthcare workers in the UK. That may be one way to start making these connections because we know that a lot of those folks have been impacted by long COVID. So just in terms of sourcing, those are 2 ideas that come to mind. But you're absolutely right. Obviously, there's distrust of the media, I think, in a lot of vulnerable communities. And especially when we're talking about, marginalized communities that are also dealing with long COVID, that's like a double whammy of really feeling failed by, I think, the mainstream media. So I think just, being upfront about why you're interested in telling this story obviously is a huge part of it, just from the long COVID side. But yeah, I would recommend potentially these three organizations as a place to start. And it's possible the long COVID source list may also be helpful there, but completely agree that it's hard to get these stories out there, just also because of the nature of people with long COVID often not necessarily being as visible if they don't have the privilege to work from home and be online in all of these groups.
Yeah, and I'd like to add, I'm sorry, Julia, did you want to say something? I'm sorry, I didn't want to cut you off because I want to tell the two organizations.
No, your perspective is much more important on this point. Go.
Okay, so I have the bot.
First, Fiona, could you repeat those three sources?
I just, can they write them down? It's hard for me to.
Yeah.
Yeah.
She said them very quickly and I didn't catch any of them.
We'll add them to the Hoover, okay?
Oh,
I'll
great.
put them in the chat.
Would you say, Amber, about that groups, organizations?
So we'll add that list of organizations to some of the notes that Fiona had put in the app.
Okay, and then I'll give the two that I know. The BIPOC Women Long COVID Long Hauler Support Group, which is a group on Facebook. BIPOC Women Long COVID Long Hauler Support Group, and that group is run by Dr. Margot Gage, MARGOTGAGE. She's from Lamar University in Texas. And she was one of the first women of color who told their personal account 3 years ago of their long COVID experience and what it was like in the initial stages as a first waiver. And she is she studies, I think she's epidemiology, if I'm not mistaken. She studies that, and she's a professor down at Lamar University. So I will reach out to her first, because that's another thing, is I think Fiona mentioned there's so much sensitivity about allowing the media to just openly and rampantly go to these people. So what I've seen her do is I've seen her just say, hey, there's a reporter from here who's available to speak and share their stories, because that kind of protects the group members and the sacredness of the group, because there's a lot of personal traumatic stories being told. And the other one is by Teresa Tyndall, TERESA She's another health advocate as well, who has a growing group. It's called the Black COVID-19 Survivors Alliance, or BCS Alliance. The Black, or it's just Black COVID-19 Survivors Alliance, or BCS Alliance. I would also get in touch with her and message her so that she can share any opportunities with the collective.
Hi, I don't actually have a question, but I just want to thank all three of you for spending your time and energy to participate in the panel, because I know it's a big hit for you to do so, and we really appreciate it.
Thank you so much. Appreciate you. Thank you.
We have time. Okay. Julie, I was wondering if you would talk a little bit about the challenges of parenting with long COVID.
Yeah, it's major. It's basically all of my energy goes to trying to work from home, because if we lost my income, it would be devastating to our family, for all the reasons that Shamir was talking about. And I feel that in my unique position as a, not super unique, but somewhat unique position as a patient researcher, I can help in some way. And then to my child, and then that's it. Like, my personal hygiene is definitely 3 on the list. It's very hard. And I think one of the good and bad things about it for me personally is my daughter doesn't remember how I was before. And so, she was 2 when I got sick. And so it's sort of part of life now. And so that is good and bad. I'll say I grew up with a disabled parent my whole life. My dad is a paraplegic, and I think it shaped me in really positive ways in terms of sort of thinking about accessibility as, just part of a way of being of like, oh, this is really easy for me and this is really hard for him and I can help. And I can see that sort of happening in my daughter as well, where she's like, oh, mama doesn't have a lot of energy. And so maybe I can do this for you. So that's kind of the nice part of it. But I definitely feel a lot of guilt over what I can't do for her, that I can't, go to the park and play and push her on the swing for half an hour because that's just way outside of my my energy limitations. And I can't honestly parent the way that I want to in terms of for example, healthy meals I would like to cook. Like, it's just not, I don't cook anything anymore. I'm making peanut butter and jelly and getting meal delivery. Yeah, I would say guilt is one of the biggest things. But I just try to tell myself that I'm doing the best I can with the resources I have. The most important thing I can do is be an emotional support for her. And, luckily my energy usually allows for that. But it's definitely a relentless part of the challenge for sure.
Let's do last two questions briefly. We got about 5 minutes.
Hi there, my name's Hannah Webster. I'm a health reporter. Thanks everyone for being here. I know y'all have made some great points about kind of the don'ts of this kind of coverage and the ways that journalists may unwittingly harm their sources. I'm wondering if we can talk a little bit about any coverage that you've seen in this area that has been done well. Kind of maybe if there are any success stories or like articles you've seen that is just like a sigh of relief that you feel like what they touched on was representative of your experiences.
Fee, did you want to take this, please?
I have a feeling we're all gonna say the same thing. Ed Yong Fan Club gathering is another name for this panel, I'm sure. Ed Yong's work in the Atlantic, I think, has been transformative in terms of people with long COVID being able to see themselves represented, and also in terms of giving people with long COVID the ability to share resources externally with family and friends and doctors that can validate our experiences. He did a piece somewhat recently on fatigue that I know a lot of people found, and a piece on cognitive dysfunction or brain fog that people found really, really helpful in kind of describing that experience. I also want to shout out two journalists that I work with frequently, Betsy Ladajets, who I worked on the long COVID source list with, who's done excellent reporting on the Recover initiative and some of the problems with it, and runs the COVID data dispatch, which often connects the dots between COVID mitigation and long COVID. And also Miles Griffiths, who is another freelance journalist with long COVID like myself, who did a piece for High Country News last spring, has done a lot of amazing pieces, but did a really amazing piece for High Country News on wildlife firefighters who are dealing with long COVID, connecting the dots there as well between long COVID and climate change, in the sense of also there being a labor shortage now in that sector because of long COVID and COVID. So those are three journalists whose work I really admire and am grateful for. There are others as well, but just want to shout out those three.
Amir, you look like you've got a list.
I have one person I definitely wanted to shout out. Of course, we know Ed Young, but I also want to shout out y'all before I tell you about this person, because like I said before, it cannot be easy to cover the nuances of long COVID in different ways, so shout out to you for even attempting to, trying to, and I look forward to reading your work in the future. But also I'd like to shout out Jamie Ducharme, who's a Time magazine writer. She has also done exceptional work of covering women of color and people of color with long COVID. She's also done a great job of identifying the disability aspect of long COVID. I also want to shout out NBC and MSNBC, the collective, because they have done a pretty good job of keeping their foots on the neck of the discussion of BIPOC communities, and also identifying some of the ways that that long COVID patients can take care of themselves, which is commendable.
And last question.
Hi, my name is Kelsey. I am a science writer who focuses on air quality and air quality policy, and I got into the world of COVID through working with a lot of the aerosol experts at CU Boulder, actually. So really been following this for a long time, and I just want to thank you so much for being here today, for using your energy and your time and sharing your insights, as we've noted before. My question is about some of the stories that maybe we haven't seen so much that are related to long COVID peoples, and that includes allies. And so not to decenter the important stories that long COVID patients have, but people, like myself, we have grown massive communities on Facebook, on Discords, as you guys are all probably a part of as well, to try to create protective communities and create resources. So for example, I volunteer for a new group called COVID Safe Colorado that does mass distribution. And I'm just curious, like, are you seeing enough of these stories out there? Would you like to see these, for lack of a better term, positive stories about the way people are stepping up and protecting each other and being role models for the ways we can support long COVID patients? What would you like to see in terms of these stories? Thank you.
I would just like to say thank you for the reporting that you're doing on air quality. That's, I think, very much like the story of our lifetime. I'm super interested in COVID cautious. Online groups have actually been pitching with no success a story on those very groups right now. In terms of allyship, I think that's a super interesting story. I think there's a political angle on it as well, in terms of kind of why maybe there hasn't been a larger groundswell of support for the long COVID patient advocacy movement from others who are not as significantly impacted. And I think there's kind of two political movements that would be interesting to look at, one being the HIV/AIDS activism that took place in the 80s and 90s, and really looking at like folks who are involved in ACT UP, for example, who are not people living with HIV but felt a calling to get involved. We don't see as many people like that getting involved in long COVID advocacy or even efforts toward COVID mitigation. I'm really grateful for those of you who are, and I know that you're out there, but I think it's not happening, necessarily to the same extent. Another thing that I've talked a little bit with some folks about is, again, sort of this idea of the spectrum of severity and why there hasn't been maybe as much of a sense of solidarity across that spectrum, right? Why people who are walking around with, let's say, a sore throat on a daily basis after having COVID don't necessarily feel empowered to join this movement, or people who have a family or friend who's living with long COVID don't feel as empowered to join this movement. And one thing that I've kind of talked with some folks in the advocacy movement about is drawing parallels between kind of the Me Too movement and the college campus sexual assault conversations that happened, and how that movement was able to really draw in people across the spectrum of experiences, how you didn't have to necessarily name your specific experience. There wasn't necessarily, we can center those most impacted while also not saying you don't get to be a part of this movement because your experience isn't as severe or isn't the same as those most impacted. But, people of all kinds were kind of coming together and saying, this is something that has affected me or something that's affected a friend, and I care about it. And so I've been curious about why we haven't seen kind of that same level of engagement with COVID mitigation and long COVID, and what I really see as kind of the catalyst for what could be a huge disability movement, disability justice movement right now, and health equity movement right now. So I love this question. I would love to see stories like that. And I think there's a real political aspect that could dig more into kind of other movements and look at historical stories here a little bit more and see how other movements have managed to do that successfully.
The Future is Disabled, which is a book that is out by Leah Lakshmi. And I cannot pronounce her last name, but her theory is that sooner or later in the future that everybody will know somebody who is disabled, and so because of that, there's going to be there's going to be a need for those who are not disabled to come into the fold, to align themselves with people who are. And so I appreciate all the allies and those, people who are connected, but I'd love to see more people who step outside of their tent doors to help tell their stories.
Thanks for having us.
Thank you so much.